to get additional information. So I'll turn it back over to you, Madam Mayor.
Questions for Dr. Nesbitt? Questions?
Yes.
Thank you. Will the next tranche of vaccine enable you to hold those pop-up clinics?
Sure. Thank you for the question. So the question is whether or not how our vaccine allocation strategy will allow us to have community clinics in partnership with community-based organizations. So our allocation strategy allows us to prioritize the post-exposure prophylaxis, which is ensuring that we have adequate vaccine available so that anyone who is a named contact of someone who is a monkeypox case. So if we have someone who is a case and they give us names and viable contact information of a individual who has had high level contact with them, we prioritize them for vaccination over at a DC government operated clinic sites. We always want to make sure that we have adequate vaccine on hand for that population. That's our post-exposure prophylaxis strategy. Then we have the expanded post-exposure prophylaxis strategy, or what's often called PEP++. Not sure why there's two pluses, but there are. And we allocate enough vaccine for that. So a good share of that vaccine allows us to most efficiently distribute vaccine through the two government clinics that operate Sunday through Friday from 1 p.m. to 8 p.m. So the majority of vaccine goes there. And then we allocate additional doses to our clinical partners such as Whitman Walker, Us Helping Us, etc. We had a clinic last Thursday at Us Helping Us. Over 100 people expressed interest in that clinic. We had allocated 100 doses. We're already in the process of scheduling another clinic there, and we'll have adequate vaccine to do so.
Do you know how much you'll get next time?
Our
from the
second
government?
allocation we learned over the weekend, it's about 4,000 doses. Unfortunately, we have been informed that this is a 2-dose vaccine, so those are 4,000 doses, not 4,000 regimens. And we have been informed that we need to plan for first and second doses. We are contemplating the adoption of the same strategy that has been used in Europe and New York City is using, given that we have the highest disease burden currently per capita, where we're going to prioritize getting first doses into people.
Anticipate, well, one, do you think the federal doses will be enough and sufficient for the need here in D.C.? Do you anticipate as well maybe going to Maryland and Virginia like we did with the COVID-19 vaccines in the very beginning?
Yeah, it's an excellent question. This strategy differs from the regional strategy that we have with Maryland and Virginia for COVID. The first piece that I'll say is that we always work as a region. We know that we have very porous borders. With Maryland and Virginia, we have a regional call every Friday, and our state epidemiologists are meeting every week. Every day. I shouldn't say every week. We meet every week, and then they meet every day to talk about the cases and to make sure that close contacts aren't lost. About 560 of the close contacts that have been identified are DC residents. And less than 100 of them are close contacts who live outside of D.C., and about 30 or so each of those 100 are in Maryland and Virginia, and then the remaining live across the country. Maryland and Virginia received their own doses of vaccine, and where we had the regional approach before, a lot of that was because of the healthcare worker piece, where a large proportion of the healthcare workers that we wanted to vaccinate in phase 1, with the district receiving a share of vaccine based on our population size, whereas 70% or more of our healthcare workers were not DC residents. So we just simply did not have enough vaccine to stabilize our healthcare system by vaccinating our healthcare workers. Whereas in this situation, the majority of our cases are happening here and the majority of our contacts are happening here, and so we need to prioritize getting those doses into DC residents.
Did I hear you say that DC was the worst in the country? Is comparing it to states as opposed to cities?
DC, the CDC provides data by state and then by jurisdictions such as states, territories, and the District of Columbia. And we have on that list, when you look at the listing, the district has the highest number of cases per capita. So that's comparing us to the state of New York, the state of California, the state of Illinois, and then the district, and then Florida, I believe, follows fifth.
63 white males were amongst the 122. How many black males?
I didn't mention 63 males. I think I mentioned 63% of our cases were amongst white males. The percent of our cases that are occurred in black or African American males is 24.5.
Yes, Dr. Nesbitt, as everyone knows, the district has a reputation of being very LGBTQ supportive, but despite that, we all know that many in the community do face potential negative repercussions if they are identified as LGBTQ. I was wondering, could you say a little bit about how the Department of Health or your partner organizations that are providing the vaccinations and treatment might be dealing with people who are sensitive about disclosing their sexual orientation or gender identity?
Sure. I think you know that this administration and I have been very LGBTQ supportive. This health department has that reputation as well. And we have seen overwhelming interest in the vaccine. We have seen people come forward and document their sexual orientation, their gender identity, all of those things. And we have a way of posing questions that make people feel very comfortable. Our interview style makes people feel very comfortable sharing their gender identity. I mean, these are simple facts, right? There's no judgment, there's no editorializing associated with it. What we want people to know is that at this point we are prioritizing the LGBTQ plus population for vaccination. And we want people to be very comfortable documenting their gender identity, their sex, and their sexual orientation. All of those things are important for us to know at this point. And our community partners have been extremely helpful. We have a number of ways to get information out. We have our ways of getting information out on our website. We have our ways of getting information out on our social media. I mean, this may be one of the times where we put a tweet out and then within 2 minutes it's been retweeted by a number of community partners and community organizations nearly 100 times within the first 2 minutes to get people vaccinated. Palm cards, all of those things are being distributed by social organizations and moving information through social networks. We can always have more people engaged in sharing information, which is why we're here today and why the mayor has chosen to be very out front on this topic as well.
We're doing press questions and then we do community questions. What's your outlook? Can you please introduce yourself with your name?
An LGBTQ community amongst the youth are disproportionately affected as being homeless. How are you reaching homeless young adults who are members of the LGBTQ plus community?
Sure, we have two strategies for doing that. We're working with one community-based organization. We have some conversations scheduled with them, and then, as you know, there was a shelter that was open last week, and we're having some conversations about potentially hosting something there.
Mayor, right here. My name is Pedro Rojas. I'm with Univision National News. I wanted to ask you about a separate topic. It's about how the buses with migrants coming from Texas and other states alike is affecting your city in regards of how you handle homeless and so forth. Because I understand that last week at least was a group of migrants that were left out at Union Station. They didn't have a place to be, and I understand that shelters in the city are being affected by these migrants.
Well, actually, we're working hand in hand with the federal government, who has released $1 million grant to community organizations to help people who are really coming to the district to go other places. We know that they're getting on buses, I think sometimes under false pretenses, traveling across the country to go to other places. So the federal government is handling the response through a FEMA grant.
That the district government will do, considering the DC Council has asked you to assist?
Well, we have to be very focused on working with DC residents who are homeless and have a right to shelter in our city, especially as we prepare for the winter months. And so we know that we have a federal issue that demands a federal response. Yes.
A question on the vaccine distribution for monkeypox. Has DC gotten as much as it has asked for in terms of vaccine? And if not, how did you go about making sure you procure enough? Was that a concern ahead of time?
So what I will say is that every jurisdiction that is experiencing a high increase in cases, which is not, this virus is not impacting all of the country the same. So there's a small subset of jurisdictions that has been very vocal about the number of cases that we are experiencing, and we've had those conversations with the federal government. We are aware that supply is limited. We have been very vocal, and we have seen the pace at which the doses are coming to the U.S. from Denmark increase. We would like it to still be faster. The second piece I will say is that we get allocation. There was a phase 1. We ordered every single dose they put on the table for us. There was a phase 2A. We immediately ordered every single dose they put on the table to us, and then now we've just gotten our phase 2B allocation. We will order every single dose immediately that was put on the table for us. So this isn't a process where we can ask for 50,000 doses and receive 50,000 doses. They're using a formula based on the number of cases that we have. And so we've been very vocal with our healthcare community to help us quickly identify all of the cases. We've been very vocal with all of our laboratories to send all of the lab results to us very quickly so that we can keep getting information to CDC in a very timely manner so that we can acquire every dose that we believe we are due.
COVID vaccine rollout at its inception wasn't always the smoothest. What lessons? Anywhere in DC as well.
DC had one of the best responses in the country. Let's be very clear about that. I will stand firm on that forever.
Well,
Go ahead.
What lessons are you taking away from what you encountered at that time with the COVID vaccine rollout to now?
Sure. With any emerging infectious disease, whether you have supply constraints. With the, what we call the pharmaceutical interventions, right? So you have your non-pharmaceutical interventions that you do, which is quarantine and isolation, and then you have your pharmaceutical interventions, which can be vaccines or which can be other medical countermeasures such as medication. When the emerging infectious disease, which means it's emerging, this is something new introduced into the community, comes, then public health often has to deal with some supply constraints immediately. Our goal when we have to work with the federal government to get things from the strategic national stockpile is to push to acquire as much as we can, as quickly as we can, and to not have it sit in warehouses here in the District of Columbia, but to get it out into the public as quickly as possible. I think what you will find with both the vaccination strategy is that we did not wait. When we got vaccines here, we had them in arms within 24 hours with COVID. The same thing has happened with monkeypox. When we had vaccines here, we were standing up clinics very early. We have had calls with our federal partners for them to learn how quickly we expanded into expanded PEP or PEP++. There are still jurisdictions contemplating how to do that strategy well over a week or two after we had implemented here in the District of Columbia. So we have a lot that we have learned from COVID, which was unprecedented, that we're applying here. One of the other things that we have done, and I think when people attempt to provide a little bit of criticism to our COVID response, is that our initial piece to address equity was to put the vaccines in communities of color. We learned that people with resources and means would drive into communities of color that they had never gone to ever before to get those vaccines, whereas people thought, well, I live in this community. When I get ready to get my vaccine, it will be here. And people came and snatched those vaccines up. You saw people from Ward 3 go to Ward 8. And the public viewed that as if the health department did not have an equitable strategy. That was inaccurate. And so what we did to address that strategy was to then begin to require that only people who lived in those neighborhoods could schedule those appointments in those neighborhoods and schedule those appointments across in those neighborhoods or across the city or wherever they chose. So we applied as a lesson learned. Now we are creating where the scheduling is done for people of color and not just simply the location. Okay, we're going to
Okay, one more. Yes.
Can we go back to off topic? I wanted to circle back to the migrants question. I know, the council members sent you that letter at the end of last week. Have you gotten a chance to talk with any of them or look at those 5 things that they wanted you to do?
I received a letter. Prior to receiving that letter, I had a conversation with Council Member Nadeau. I haven't talked to any other council members, but I will go back to what I said earlier: is that we're dealing with a federal issue that the District of Columbia won't be able to bear. So it requires the federal response. Yeah. Yep.
Contracts they had with the city. Any thoughts on that?
Well, Lou, I'm sad about it. I think that a lot of people here know Ruby and know the organization, and especially know the organization when it was doing work that nobody else was doing. So I'm very sad about it. But I also know when we give hundreds of thousands and millions of dollars and vendors aren't getting paid, employees aren't getting paid, we've got a problem. We got a problem. So none of us can turn our back on it. We have to fix the problem. So I'm sad about it because that was an organization that has done good work. We have to figure out what happened and fix it. Yep.
Answer some
Yes.
questions.
What's your question?
It has to do with the shooting Saturday night.
Yes, Chief.
Hey, Paul.
Hi, Chief. It's my understanding, unless your general orders has changed, that officers who are off duty in the city have a choice as to whether or not to arm themselves. So what does it say that your officers that night were in that restaurant armed and was ready to take police action in this case?
I think it says that they care a lot about this city. We've seen across the country mass shooting incidents that have happened all over the place. I think recently there was something that happened at a shopping mall recently, and with the influx of guns in communities all across the country, the fact that we have police officers out enjoying a night to themselves or dinner, but yet forsaking all of the fact that they were there for themselves, decided to take action in a situation that could have been very dangerous and deadly for other visitors to that area. I think it says a lot about their character.
Well, do you know if the officer's partner that night, did she pull her weapon?
I'm not sure. It's part of the investigation. I'm not sure. Based on some of the things that I've seen, I'm just not sure about that right now. That'll come out during the investigation.
All right, and then based on our reporting, it appears that Lazarus Wilson has an extensive criminal history in Virginia. What does it say about him being in the city, and do you know why he was there and what he was up to?
That's all part of the investigation, Paul. When we talk about violent offenders in communities, especially violent offenders with firearms, a lot of times we find that they're not strangers to the communities. They're not strangers to the criminal justice system. So I'm not surprised that there's an extensive criminal history. But again, as we go through the investigation, we hope to learn more.
I heard something about an exchange of gunfire. A lot of it. Can you tell us at this point what you can tell us?
So as you saw in the press release, or may have saw in the press release, there's an image of an individual pointing a firearm. There's an image of the firearm that was recovered that was in the press release. We know that our 2 members were inside of a restaurant having dinner. We know that while they were inside of the restaurant, whatever happened on the outside of the restaurant, the gun was introduced into the scenario. People started reacting, started to really flee from the area. Some people were going under tables, and these officers went toward the danger where they saw the threat, where they saw the person with the firearm, and they took action. With respect to the exchange of gunfire, preliminarily, at least to this point, it does not appear that there was an exchange, but again, we're going through the investigation, so I'm not 100% certain about that right now. We know that one of our officers fired at least one time, striking the suspect in this case, fatally injuring him. I'm not 100% certain about that, Sam. It's the early part of the investigation, and forensically, as they examine and pick up little pieces of things all over the place, we'll get to that as they examine the firearm, etc.
All right, last
Chief Conti, on that note, my understanding is there is not body camera footage of the shooting. Would the city commit to releasing security camera footage of the shooting?
So the city, we will, as we do in all shooting situations, especially when if there is body-worn camera, we have body-worn camera from officers who responded to the scene, the first responders. We'll get that to the mayor within 5 days, and then a decision will be made, especially as required by law, things that are in the greater public interest. If there's a decision to be made about releasing the video, then it'll be released at that time, and that decision has not been made yet.
All right, thanks.
His wife, and why are only one of them placed on administrative leave as the investigation, or is the second one also on leave?
So in our shooting situations, it is a fairly newly promoted commander, no stranger to the police department. He's been on over more than 15 years for certain. But aside from that, our members, when they are the subject, or they are the person who engaged, who used force. In this case, he was the only one that used his firearm. He was placed off on administrative leave, and I believe the second person may be on administrative leave, but that's kind of escaping me right now. But the requirement is for the person who used their firearm. In this case, only one person.
Thank you.
We now return to our previously scheduled program.